Today in Canada, we're only testing people who show symptoms of COVID-19. Yet experience throughout the world is showing us that this testing regime is not good enough to get us through this crisis. As MLI Senior Fellow and physician Dr. Sean Watley explains, if we're only testing people with symptoms, and not even all of them, Canadians will only be aware of a fraction of the cases of COVID-19. A broader and more robust testing regime will be indispensable in allowing Canadian life to return to normality sooner rather than later. Why are we testing so few people? Simply put, because we don't have enough test kits. Sure, the US is in a worse position, but that is no excuse for Canada's poor performance. We squandered the months leading up to this crisis, despite knowing that our supply of test kits was woefully inadequate, and we failed to act decisively to correct the shortfall. The lack of testing capacity is emblematic of a larger failure of government to act quickly and with purpose in the initial stages of the outbreak. The federal government adopted an intentional posture of appearing calm and rational throughout January and even into early March. While America was closing its borders to foreign travel, Canada continued to welcome plane loads of people from areas that were soon after declared to be near the epicenter of the pandemic. In retrospect, our calm, rational approach now looks sluggish and imprudent. It will no doubt generate commentary long after we get through COVID-19. What exactly drove us to do so little? Doesn't the Federal Department of Health exist to protect Canadians from external health threats like this? Countries that have more successfully managed the pandemic took the opposite approach. Taiwan, South Korea, Singapore, and others focused their attention on developing rapid tests, technology, and personal protective equipment. In particular, Taiwan ignored what Beijing and the World Health Organization were initially telling us, that the virus did not result from human-to-human transmission. Instead, the Taiwanese acted to control travel from Hubei as early as December of 2019. As MLI Senior Fellow J. Michael Cole points out in a recent MLI paper, several months ago China was criticizing Taiwan for putting too many resources into producing masks and developing rapid testing. Taiwan partnered with industry to increase production. It supported development of rapid test kits, with results available in hours instead of the days it takes in Canada. Now that Taiwan has successfully managed its pandemic, it has begun to export its equipment and technology around the world. Also of note for Canadians was Taiwan's decision not to send masks to China during the outbreak, preferring instead to ramp up its own production capability. In contrast, Canada decided to send 16 tons of protective equipment to China in February, even though we lacked surplus equipment, failed to ramp up our own production, and had good reason to suspect the outbreak would soon land on our shores. The approach adopted by Canada has meant that instead of being prepared, we have consistently had to react, being dragged along by events. Because our healthcare system is woefully unprepared to confront the pandemic, the goal has been to flatten the curve, by which is meant spreading the demand for acute health services out over weeks to months instead of days. Canada's belated moves towards isolation do help to flatten the curve in the early stages of an outbreak, and might even decrease the total number of cases. People will still end up getting the infection, however, and while a flattened curve will result in fewer deaths, that is little consolation to people who were failed by the government's tardy and reactive approach. There is still time to do better. Our isolation strategy can be effective, but it can only be a temporary measure, and it puts a serious strain on the economy, creating suffering all its own. Had the government acted sooner and more effectively at the beginning of this crisis, we might not find ourselves with the viability of our healthcare system, the health of Canadians, and the functioning of our economy at fundamental odds with one another. So, the government must lead, and not be led by, events. and where their leadership is most desperately needed, is in using the pause created by our period of self-isolation to put in place a plan to get Canadians back to work as soon as possible and getting the equipment to make that possible. Getting people back to work is terribly important, and we have to do it even before we can be 100% certain that all risk has passed. Getting this right may be even harder than handling the pandemic itself. This means that we need a rapid, cheap, and reliable test that can be used widely and quickly stockpiled. Test kits cost a fraction of the cost of one visit to the emergency department, let alone one day in an ICU. With such testing, it becomes possible to identify and then release completely from quarantine measures and further testing those who have acquired immunity. Others could be tested weekly and be allowed to work until they test positive for exposure. Once those who have been exposed to the virus are identified, they can be quickly quarantined, whether they have symptoms or not. And available mobile phone apps or other methods can be used to track them to ensure they are following the rules. Importantly, once they have developed immunity, they too can be safely allowed to return to work, creating a virtuous circle. Widespread testing also builds public confidence that it is safe to come out and return to something close to normal life. Finding a rapid test was one of the first priorities in Taiwan, with its research institutes moving quickly to develop rapid screening reagents and to find ways to reduce testing time. Tests now exist that can show within 20 minutes if someone has tested positive. But we need to keep the pressure on for faster, cheaper, and easy-to-produce kits. Returning to work also requires user-friendly, widely available equipment like masks and gloves and sanitizer for those who work with the public, for example. We might experiment with occupancy rates in enclosed spaces, such as offices, just to get people out of their homes and back to being productive and connected with their fellow Canadians. The specifics are not as crucial as the commitment and the courage to get it done. Whatever we try will not be perfect or risk-free, but the risk and cost of doing nothing and remaining isolated will increase the longer we avoid getting back to as close to normal as possible. COVID-19 has been a stress test for Canadian healthcare, the economy, governments, and our nation as a whole. Stress tests are good. They show us what we need to change. And change will require all of us working together, regular citizens, businesses, healthcare workers, and of course, governments. Canada became great by finding ways to solve our problems rather than being defeated by them. We didn't sit and wait for someone else to solve them for us. COVID-19 is and should be no different. I'm Brian Lee Crowley for the Macdonald-Laurier Institute.